Good afternoon, everyone. I'm Ruby Hawker with the American Lung Association in Minnesota. Welcome to the 2016 Asthma Webinar Series. Thank you to United Health Foundation for supporting this webinar series, and a special welcome to our United Health Foundation partners in Asthma Action coalitions joining us across the upper Midwest. Before we get started, I have a few housekeeping items to cover. All lines will be muted, so if you have a question during or at the end of the presentation, please use the chat box function on the lower right-hand corner, and we will address those as they come in. Also, a copy of the recording of today's webinar will be shared with all participants, and feel free to share with your colleagues. It will also be available on the Lung Association of the Upper Midwest YouTube channel. And now I'm pleased to welcome Dr. Nick Antos, pediatric pulmonologist at Children's Hospital of Wisconsin. Dr. Antos completed his medical training at Rush University in Chicago, his residency at Advocate Children's Hospital in Oakland, Illinois, and his pulmonary fellowship at the Medical College of Wisconsin, where he stayed on as an assistant professor of pediatrics. Dr. Antos is the Associate Director of the Cystic Fibrosis Center, the head of QI for his division, and the Medical Director of Southeast Wisconsin School-Based Asthma Management Program, which is SAMPRO. And now I will turn it over to you, Dr. Antos.
Great, thanks Ruby, and thanks everybody for logging in and listening. So as Ruby kind of mentioned, what I'm going to talk about today is what we call SAMPRO, and this is the School-Based Asthma Management Program. And I'm going to give a little bit of overview of SAMPRO in general, then specifically talk about some of the initiatives and some of the research that we've done here in Milwaukee. And so first to talk a little bit about school, and everybody who's listening, of course, has some idea of this or you wouldn't be here, but school is extremely important. As you know, kids spend most of their day and about a quarter of their childhood in school. And that's true for any chronic disease or any lung disease, that school needs to be a big part of their care. But particularly for asthmatics, starting school is really unique. This is kind of when they have to start doing their own self-care, when they're around new kids or unfamiliar contacts, so people who don't know anything about their asthma and triggers and some of the problems that can arise. And there's also a lot of new exposures. And we'll talk a little bit about all these different pieces as we go along. But for instance, my daughter went to kindergarten this year and she has asthma, and that first day of school really was a big deal because of all these things that on some level she had to know. Asthma in schools is also quite prevalent. We always say the average is about 3 students per school classroom that has some degree of asthma, so definitely it's something that every teacher and every school nurse has to deal with. It's about 1 in 10 or 1 in 13 kids, as you know, that have asthma in the U.S., and in some of the schools that we'll talk about, specifically the schools in downtown Milwaukee, the prevalence is a little bit higher because of the fact that it's a larger African American community. We also know that if asthma is poorly controlled, it actually affects school performance. About a third of asthmatics report some degree of school absences, and the average is at least 3 days of schools that are missed because of their asthma. And if asthma is poorly controlled, that can hurt their academic advancement, their reading proficiency, their test scores. So there's a lot of reasons that asthma can affect school itself. And with that, as I mentioned, self-care is really important in asthma, and even more so than most chronic diseases. As you all know, the medications, especially the bronchodilators, are used as needed. And so the kids have to, on some level, realize when they need it and realize when they have those symptoms. And that's often a new thing in school. It's something that they're not necessarily used to. Their parents at home can usually poke them to say you need your medication when they're short of breath, but the teachers and staff at school don't necessarily have either the knowledge or the ability to do that. And then also for some of the adolescents and the older kids, school is kind of their first taste of adulthood as well. So they have to be able to know that they need their medications, also because many times they'll be the one administering it. So it's a really important part of their life in general, and especially their asthma. Despite this, though, school really isn't a major part of the history or the elements of asthma control. We often asked about school days missed to get some idea of how much it's hurting them, but we often don't really focus on how is your school, are you having problems in school, are you having any symptoms at school? We don't always talk about that. Also, school nurses or any of the school healthcare team are really not a major part of the medical team. We don't get information from them. We don't necessarily send them information. And they're not really considered a big part of the healthcare team, and they really should be. And I'll use the term school nurse a lot in this presentation. We know that most schools, not most schools, but many schools do not have a school nurse. So when I say school nurse, I kind of mean whoever the school healthcare provider is, so whoever is managing or has to know about their asthma. And most of the time there is a school nurse that is overseeing that care on some level. So even if they're not the one giving the albuterol, they are the champion for the kid and do have some control of what goes on in those schools. So despite all this importance, there really hasn't been a lot of resource or efforts that have really focused on organizing and improving school-based asthma care. So one of the main things we'll try to answer today is what can we do to help school-based asthma care? What are some of the problems and what can we do to help it? And so this is where SAMPRO came along. And what SAMPRO is, it's set up by the QuadAI, the American Association of Allergy, Asthma, and Immunology. And it was the brainchild of Dr. Robert Lemansky, who was the president of QuadAI at the time. And what the goal is was to create a central resource that was sponsored by QuadAI. And we also had support and collaborated with the National Association of School Nurses to try to make a good toolkit and tool area to allow for there to be resources for people to help with school care and to help to kind of organize some of these efforts and really just to get the word out of the fact that school is important and we do need to do things to improve school-based care. Most everything I'll talk about today, at least all of the tools that I'll talk about, are available on the QuadAI website, on the SAMPRO website specifically. If you go to quadai.org/SAMPRO, it will link out to the toolkit itself. Also, if you just Google QuadAI and SAMPRO, it will take you there. There is a login to get into the site. It's partly just so we can tell who's using the tools and see a little bit about the people that are using it, but everything is free that's available on there. SAMPRO itself was started with a work group meeting and a summit that we had in Washington, D.C., with pretty much lots of providers from across the country in both healthcare, schoolwork, nationally as well, to try to get some of people together at the same table to talk about what needs to be done. And we published a white paper with some recommendations in the September issue of the Journal of Allergy and Clinical Immunology. And you can pull that up either on the JC site, the Journal of Allergy and Clinical Immunology, or on the SAMPRO site as well. That paper is available there. And what we talked about in that is that there's really 4 essential components to any successful school-based asthma program. That includes something called the support that I'll show you in a second, provider to school communication, and we talked a lot about the importance of asthma management plans, and we'll go into that in detail. School personnel as well as school student education, and environmental assessment and remediation. And so this is what's called the circle of support, and we talk a lot about this in the white paper, and a lot of what we talk about centers around this. As everybody knows, there's the old saying, it takes a village to raise a child, right? Well, that's really, really true for asthma, and especially true for asthma in the schools. So what the circle of support has is the child at the center and every other piece surrounding it. So you need help from the healthcare team, you need support of the school nurse or the school team. Obviously, you need the family's buy-in to understand the asthma, to get some of the medications to school. And then surrounding all that is the community. And the community is especially important in school for lots of reasons. Partly, of course, the community determines the school. Everybody from the community goes to that school. But also the school itself, the school building, the administrators there, all of that are part of that school community that's important for asthma as well. So there are a lot of people and a lot of moving pieces that need to come together to make adequate and good school care. But let's talk for a second about school nurses. So as I said, controlled asthma helps school performance, but also we know that with school nurses in place, asthma control itself improves. There's less missed school days, and it really is just overall better care for asthmatics. As I said, not everybody has a school nurse, but really school nurses are really the front line of care for students. And I like to liken them, as you see in this picture here, to nurses in the trenches in World War I, because they really are the ones on the front line. They're seeing what's happening. They're the ones who often actually give them rescue medications, and they can actually see how well controlled the kids are. And I'd argue that a lot of the time, the school nurses may be the only one, probably the only one at all, who knows whether the kid's asthma is controlled or not. Partly because they're going to be the ones who are going to be seeing the kids when they're sick. They're going to be giving them the medication. So if the parents at home don't know, the child may not tell them. As you all know, the child's certainly not going to tell us when they come to clinic. So really, the nurse may be the only one who knows how controlled the kids are. And again, there's really little or no direct support from the asthma providers to the school nurses. And so with some of the work that we did specifically here in Milwaukee, we did some focus groups with our school nurses and wanted to find out what some of the problems and thoughts and concerns that they had were. And the biggest thing they said is that they had concerns about the lack of asthma orders that were available. And when they said this is work that my fellow and I did, our first thought was, I've never sent an order to a school nurse in my life. And so that right there was kind of a good example of some of the education that we need to do. And so as many of you may know, what I'm referring to by asthma orders are any of those school forms that we do in clinic, those school authorization forms, permission forms, asthma action plans, whatever we call the forms that we send to school, those really are orders. And I think that's an important teaching point for asthma providers because we sign a lot of orders for home care and other things like that. And I think most doctors don't really look at those school forms as being the same thing, and certainly not on the same degree of importance. But in reality, that's exactly what they are. With that, these orders are actually generally the only way that we talk to schools. And so when you talk about that second element of clinic-to-school communication, these asthma orders in their many forms are generally the only thing that we have between the two of us. Right now, the way it works is that a patient's seen in clinic, we sign whatever form they give us, and unfortunately, they generally give it to the provider as they're leaving in like the last 2 minutes of clinic, right? Then we give it back to the family, and we just hope and pray it gets to the school. And often we do it kind of disgruntledly because it's kind of a pain to do very quickly, and they're difficult forms. And again, going with that World War I analogy, it's like sending a pigeon to the front lines. I hope it gets there. I don't really know what happens. I don't have a lot of ability to follow it up, unfortunately, but we hope that it gets there. And so this model really isn't great, and there's a lot of barriers to communication. And this is just some of the examples of things that we found here in Milwaukee. One of the things that really is a big issue is the fact that often every single school district and sometimes every single school has a completely different form. They're often just blank fill-in sheets. The parents have to bring it to the clinic. There's a lot of difficult reasons why this often doesn't work. And so then this led us to the question of, how are we actually doing in South Region, Wisconsin? So how are we doing in the Milwaukee schools? The nurses, again, thought that they weren't getting many orders, but we weren't quite sure because we feel like we spend a lot of time filling out school forms. And so the work that we did was specifically in what's called the Children's School Nurse Program. And with this, Children's Hospital of Wisconsin, our home organization, funds nurses in 10 specific schools in underserved areas in Milwaukee. And you see those are the ones in pink in this picture. And these really are a lot of the areas that have difficult socioeconomic status and kids that really are in high need. These are unique places and unique opportunity as these nurses use our electronic health record and they're part of the CHW team, but they really truly are school nurses. They just happen to be funded by us. And although this was led by us as asthma doctors, it really was focused on the perspective and needs of the nurses. And so what we did is we went into the schools and we specifically had the nurses send us a count of how many asthma orders they had. And this is what we found. And the way this chart works is called a P chart. It's something we use in quality improvement. And each dot is a different school, and each one is the percentage of asthma orders that they had on file, okay? The percentage of asthmatics with an order on file, essentially. And what we found is that we really weren't doing very good. Now, this was pulled in at the end of the first month of school, and only about 10% of kids had an order on file. So essentially 90% of kids had absolutely no orders. And again, presuming this is the only way that we talk to nurses, that means most of the kids by far had no communication between the nurse and provider. And if you look at it in more detail, these dotted lines here are what we call the control limits, and anything above or below that is statistically significant. And the way it works is the smaller schools are there on your left, like A and B, and the bigger schools are there on your right, like H and I. And the bigger schools, as you can see, really had less orders, and some of them as low as 1 or 2%, with some of those being statistically significantly lower than the rest of them. And so with that, we can tell that the bigger schools, where there's more problems and there's more issues overall, there's way more issues with asthma orders as well. And so then we measured for the rest of the year. We figured, all right, maybe we measured too early. I'm sure it gets better during the year. And we found that, yeah, it does, but not a whole lot. So it doubles. It goes from about 10% of asthmatics having orders to about 20%. And then it just stays there. So once you hit about this time of the year, every form you're going to get, you've gotten. You'll notice the number drops a little bit. That's partly because kids move around to different schools and the forms don't necessarily go with them. So it wasn't that anything worsened. It was actually just people shifting around, interestingly. And so one of the things we try to do to make it better is we gave some power to the nurses to send a letter directly to the doctors. Initially, we did it just passively, saying, okay, when you see a kid that doesn't have one, please send this to the doctor. And then we had it send it to everybody. And when you look at that data afterward, this is just specifically in those larger schools because they are such a big deal. That first year is those first 3 lines on the left. And then after we did this are those second 3 on the right there. As you can see, it went up pretty steadily afterwards. And everything that's above the median, if you have all of those dots above the median, that's also considered statistically significant. And that certainly happened even just in that second poll. And when we had them aggressively send out those letters, as you can see, it got pretty high in some schools. And specifically those 2 that got the highest that are circled here, those ones, the majority of forms were the forms that the nurses had to send to the doctors. So the nice thing is it shows that this sort of intervention, having the nurses do something, can work. The bad part is it meant it took that much to actually get it done from the doctors. And this sort of process, although it worked great with the nurses that have the electronic health record, it's not necessarily sustainable all over the place. So that leads to the question of just this simple piece of school communication, how can we get this better? And so at the summit for SAMPRO and with the discussions for the SAMPRO work group, we really decided that asthma action plans really are the best way to do this. Partly because they get the nurses the information they need, they're very easy to read, they cause the least disruption to clinic, as every asthmatic, as you know, should have an action plan, although unfortunately in Wisconsin overall about 30% do, that includes in adults and kids. But it's something that everybody should know how to do and should be able to do regularly. And so essentially, if we could get a school form that combines the asthma management plan with all the information for school, that I think would be a great improvement. It would really be a much better pigeon than what we're using now. It's something that if we could get standardized for everywhere would help get rid of some of the barriers. And really, if it can be accepted at all schools and we can just pull this off the shelf, from a provider standpoint and a school standpoint, I think it would make things a lot better. And so one of the things that's in that document is this specific form, and this is what we came up with as the SAMPRO work group. It includes the normal stoplight zone of an asthma action plan, and also a lot of other information that's helpful for school nurses. And there's a lot of stuff packed into here. It includes things like the severity of asthma, although right now we don't necessarily think to tell a nurse if a kid has mild, moderate, or severe persistent asthma. Just that piece of information itself is actually really important. It gives the nurse just as much information as it does me clinically. Things that are also useful for nurses to know are kids who have really bad, severe exacerbations, so the ones that are okay most of the year, but when they get sick, they get really sick. That's useful for the nurse to know that those kids shouldn't be ignored. The asthma triggers are extraordinarily important, and we'll talk about that in a little bit. And then we also included information about whether they can self-administer and whether the nurse agrees with it or not. Partly because of the fact that, and this is right here on the form, is that if we say it's okay but the school nurse doesn't, that doesn't necessarily mean it's something they should do. We also included parental permission that we can talk to the nurses and vice versa, because really, ideally, I'd like to start this being a normal part of the asthma visit, that we talked to the school nurse and we got communication and we know what's going on in school. And lastly, down here at the bottom, we do want the nurse to send a signed copy back, because that can really help to complete that full circle of support if we know that, okay, this got to the school, I don't necessarily have to worry about it. That being said, I send one of these every single time I see the patient, whether they ask for it or not. This way I can at least assume that one of those times it may get to the school. With that, we also included a separate form that looks like this. And this can be used with any sort of asthma management plan. It includes all those essential elements as well, including the severity of asthma. And what this is for is we already may have an action plan that you like. It's okay to use that, but attach this to it and they should be able to bring it to most schools. Now, it's going to take some time for every school to accept this, but here in Milwaukee, we've already made a lot of headway with the school districts here, and many of them are going to change to using this as their main form. So I think if we can get something that we can pull off the shelf, it'll make it easier and work a lot better for all of it. I would encourage those of you in asthma clinics to use these sort of forms and give the parent to give to the school. Even if it's not the main form the school district wants, at least the nurse will have something. And probably one of the most important parts is just including your contact information. So if they want something different or they need something different, or again, if your asthmatic is not well controlled, the school can let you know. To get it there, most of the time you're still going to have to hand it to the patient, but over time there is going to be more direct electronic messaging. They can be faxed to the school, and I hope eventually we'll be able to do all this seamlessly so we can just give the patient, we can just do it in clinic and we don't have to worry about getting to the schools. So there's a lot of different ways. Sometimes through the EHR, you can fax it directly through the EHR. It doesn't always show up great, but you can also just fax it from the school fax print from your clinic fax rather to wherever they need it for the school. That's sometimes difficult because if the parents didn't bring the school form, I'm sure they don't know the fax number. We've also done some work with some of the school districts to try to get either a central fax number or at least a list of all the schools and fax numbers to have available in clinic, so we can try to help get some of this done without just relying on the parents remembering to bring it. Beyond that, then, there are a lot of different ways that providers and asthma care teams can help just beyond the Asthma Action Plan. One of the ways is, again, in clinics, making sure that you talk about schools, school needs, and include that in your assessment and control. Make sure you're asking about school. Also make sure that they have medications and spacers available for school. It's something that we think about and often take for granted as a healthcare team, but it's something that definitely we have to make sure the families know to bring as well. There also are school-based clinics in some of the schools or school districts. These are meant to be a supplement to the primary doctor or the specialist. I know historically some doctors haven't liked these school clinics taking over some of the care, but their goal is really not to take over care, it's just to help care and to help support what we're trying to do. And it really can help with a lot of the disequity for those who are unable to reach higher levels of care. There also are many different collaborative organizations and projects, including things like Building Bridges and Easy Breathing. There was a recent article about building bridges as well. And all of these are great ways to combine what we do as a healthcare team with the schools and make sure everybody is communicating and everybody's on the same page. The next piece is school education. And as I mentioned, this includes both the school healthcare team and the students as well. Back to the school nurse briefly. The actual definition of the school nurse, and I'd like to read this because it's very poetic, is that it's the specialized practice of professional nurse that advances the well-being, academic success, and lifelong achievements of students. Very well written and truly what they do. Now, of course, for our disease, for asthma, they do a lot of the acute care. They can recognize the symptoms. They can give medications. And as I said, they may be the only one who knows that the child is not in control. But school nurses are way more than just acute care nurses. There's a lot of other things that they can and do that we may not realize. That includes the fact that they really are a health educator. They're in the school. They truly are educators. And part of that, especially for asthma, is that they're in a very unique place to identify some gaps in asthma knowledge. There's some inconsistencies in their care, and also, once again, those components of asthma control. So, for instance, if every day after gym, the child is coming to the school nurse and coughing and having symptoms, and they need their albuterol, the nurse can say, maybe you'd feel better if you took your albuterol before gym. Or they can say, maybe you need a controller medication, maybe you need to see your doctor. They also are the champion for the child as well. So, for instance, if a kid's always having symptoms after they go to English and there's nasty old carpet in there, they can talk about that carpet in English class. Or they can talk about the pet hamster in science class that probably is not helping that rodent allergic child. So there's a lot of different places and abilities that the nurse has to help with asthma control. They also do a lot with care coordination in general. They work a lot on the IEPs. They can give the medications. And they also can discuss directly with the doctor. Again, something that doesn't really happen now, but really should happen a lot more, and I hope will happen more over time. And lastly, they just know the kids. We see them from 15 to 30 minutes every 3 to 6 months, right? They see them multiple times throughout the week often, multiple times through the school year, and they really are a normal fixture in these kids' lives. So if they're not going to listen to us in clinic, they may listen more to the people who see them regularly and they're more comfortable with. But school nurses aren't everywhere, and this is true in general. So asthma education is really important for all staff. And the 4 things that through SAMPRO we think are most important for them to know are being able to recognize worsening asthma symptoms and specifically acute warning signs of distress and when and where to get help. So they should be able to know if a kid looks like they're having respiratory distress or difficulty breathing. And then have a knowledge of asthma care plans, specifically what's called the Asthma Action Plan, as you know, or the Asthma Emergency Plan, which is the kind of the school plan for what to do for kids having an asthma attack, especially if they don't have orders. It's also very good for the school staff themselves to know those elements of asthma control, because if the nurse might not know the kid's not in control, it may actually only be the math teacher who has that kid after gym that knows that the kid's having the coughing after gym. So really it's important for all the school staff to have some idea of these general elements. And ideally, everyone at the school should have at least a rudimentary knowledge of inhalers and EpiPens, as you know. My wife was a school teacher for many, many years, and until our daughter's asthma, she had never been taught anything about an inhaler. And so making all of this happen will require certainly time and resources, and it's becoming more required for some of the school educators in general. But this certainly overall is something that we want to increase the prevalence of and make sure that it's part of the important education for for the school staff, rather. Lastly, student and family education is also, of course, extremely important, as we know in asthma in general. There are multiple educational programs that are available, and I'm sure many of you know some of these very, very well. The American Lung Association, of course, have their Open Airways for School. There's IGGY the Inhalers, which is a comic book-based one that has a lot of good overall explanation of the medications. Fight Asthma Now, which was developed for Chicago schools. There are a lot of great resources for teaching the students directly. With that, these programs can be done directly in the schools, and so they're good at being able to educate the children in a spot that they are more regularly, not just our clinics. With that, though, it's something that the reason these can work better is they can be integrated into all of the points of care, including the school, as I said. They can address some of the health literacy and multicultural beliefs, because often these are done in the community. So again, that community importance, they can know what the children in the areas know. Lastly, school nurses being involved in the education is very important, as the school nurses often are the only ones who know which kids either have low knowledge or are at high risk for poor asthma control or are having lots of problems. So they are a great resource to identify who needs this education. With that, though, buy-in from the administration and the administrators is extremely important. Without having the principals allow you to let the kids do these sort of programs, it's unfortunately not going to get done and not going to work. So starting an open dialogue with the administrators is also very important. The next piece is the environmental piece, and this again includes the community itself and specifically the community surrounding the school. And so, as I mentioned at the beginning, school is the first and often frequent site of exposure to allergens for many kids. And if there's poor indoor air quality, this can really severely affect the asthmatic children and also the rest of the staff. We know if there's poor indoor air quality, in general, staff absences and staff symptoms worsen. So reducing these exposures can reduce, of course, the frequency and severity of exacerbations. You can see a list of all the possible allergens and irritants in the school itself there on the right side. As you can see, it's pretty much anything that you would think of as an allergen or irritant in general. All of them can occur in the school and often do with more frequency than they do at home. An example of this actually is pests. Evidence of many different pests are found commonly in schools and school cafeterias, and this can be either more or new exposures than at home. This specific study was done in the schools in Boston, and as you can see, the orange bars there are school and the blue bars are at home. I'd like to tell part of the story of how this study was done. It was initially meant to be a study of whether there was peanut on the tables or not, looking at food allergies. And though they found almost no peanut, they found a whole lot of evidence of mice being on these school cafeteria tables, despite the fact that no one had seen any mice or no one had seen any mice droppings. So, and in this population specifically, that orange bar is way higher than the blue bar. And so it definitely can be a big problem for the kids that they might not have remembered before or known about before. And so making sure that that school team and the school nurses know what the allergens and triggers are for these child are really important, because if they're going to school and suddenly getting not in control, it could be one of these things that's causing the issue. With that, there's a few things that are recommended both by SAMPRO and in general. One of them is what's called integrated pest management. This was an EPA initiative that was started in 1996, and then it was renewed in 2012 with a new strategic plan. And what they want is specifically a 70% reduction in both pest complaints and pesticide use. That may seem a little bit counterintuitive, but the point is that the goal should be more green pest control, of preventing those pests from getting in the first place. And with that, decreasing the pesticide use, because of the fact that the pesticides themselves are an irritant as well for the asthmatics. More information as that is available at the website of the EPA. There's also what's called indoor air quality management programs, and most schools should have some indoor air quality management programs set up, trying to improve some of the air quality management. Schools also do have to have regular inspections for pests, although the quality of those inspections and what they find is often questionable. But with that, then, the healthcare team, both us as the asthma care team and the school nurse and the school healthcare team, really are the champions for the asthmatics. So making sure the administrators know that these things are important and it really needs to be addressed is a big part of what we need to do. An example of this is here in Milwaukee is Wisconsin Asthma Coalition School Walkthrough Program. What they do is they literally walk through the school, look at the different classrooms, the different areas, and look for things that can identify the asthma, that can trigger the asthma, can be bigger issues for the asthmatics. What this program specifically focuses on is really low and no cost solutions and issues, meaning our goal is not to walk into the school and tell the principal that you need to buy a new roof. It's more to look at the things that they can fix easily and quickly, focus on some of the low-hanging fruit, as it were. And then we also identify, or they specifically identify, a staff champion, be it a school nurse, a janitor, whoever is the person who can help to clean up some of these things. They've done many different walkthroughs in lots of different districts, and they're trying to increase the numbers. And you can, of course, visit the Wisconsin Asthma Coalition website. But there's many programs like this that can help to at least get an idea of where some of the initial problems or triggers are, and to help remediate them on whatever scale is appropriate. So in order to make these sort of programs work, the best way is how to get it implemented overall and disseminate it and get it to keep working. There is some national legislation for this, and we're certainly not going to talk about politics today, but there is specifically something called the School-Based Asthma Management Program Act. This was introduced in March of 2016 by Representative Hoyer from Maryland and Dr. Rowe from Tennessee. And what this bill does, I'm sorry, I got cut off a little bit there. What this bill does is it's specifically to help ensure basically that Congress agrees with trying to help improve and agrees with what SAMPRO is doing. So it talks about the importance of getting assistance at school with managing chronic disease, helping to improve their asthma environment, and then also helping to make sure that there is a supply of asthma-related medications, and preferably stocking of the albuterol in the schools and permitting of the administering of these life-saving medications in an emergency. Much like we've done with EpiPens. Some of the bad press around the EpiPens thankfully has recently died down, but we do want the same idea for albuterol. It's important to have around. So with this, I encourage really everyone to get involved to help improve school-based asthma care. So whatever you're currently doing to help improve asthma, as I know you all are, definitely include school in some of your thoughts, discussions, and recommendations. I think it's something that we know is there, but we don't often reinforce as being such a big, important piece. In clinic, ask about schools. Make sure that people are mentioning school, and identify some champions in the community and in your areas to take on these initiatives to try to make sure that school is something that we're really focusing on. So in summary, we can talk more about some of these specific pieces at the end, but what SAMPRO really does, it introduces a widely endorsed system to help coordinate the asthma care for children among the clinicians, schools, and families. And we really advocate the use of all 4 components, so establishing a circle of support, developing individualized asthma management plans, and making sure these plans and some asthma plans get to the schools, and really making sure that communication with the schools is an ongoing and important piece. Also, the schools should develop their own comprehensive asthma education plan for the children, the students, and the staff in the schools. And it's very important to make sure that the asthma triggers and the environmental issues are looked at and try to reduce as much as possible. The SAMPRO recommendations and the toolkit have been endorsed by multiple things, including the American Academy of Pediatrics, the American Thoracic Society, the American College of Allergy, Asthma and Immunology, the Asthma Allergy Network, the National Association of School Nurses, and of course, QuadAI, where we set it up from. So all the people have agreed to support this sort of work, and that a form like the one we created is very helpful for the children. I would like to thank, of course, the American Lung Association for inviting me to do this talk, QuadAI and the National Association of School Nurses for supporting SAMPRO, the Wisconsin Asthma Coalition is Kristen Grimes, who helped support our research, and Dr. Lemansky and Dr. Kakamunu, who was my partner in the clinical piece for SAMPRO. I'm in a lot of their help. And then, of course, our home divisions and the school nurses we work with especially. And, of course, all of you for your listening. And I see there's already some questions that I can address in a second. But again, overall, what SAMPRO does is to help to improve the asthma care for kids in school and help to support this circle of support to make sure that we're really making this an important part of asthma care. Thanks for listening, and we'll take any sort of questions in the bottom. I see there's already some there from Kathleen. Let's see.
Thank you. Yes, please type in your questions into the chat box on the lower left-hand corner, and we will start getting to these now.
Yes, I'll move. Here's the plan, and a lot of the questions that Kathleen typed here specifically have to do with the form itself. And so it depends on, one of her questions is whether it satisfies HIPAA to fax directly to the school and about the bilateral communication. So we have the communication that's in this portion here at the bottom right here, vetted by both the lawyers at QuadAI to represent the clinical piece and HIPAA, and at the National Association of School Nurses. As many of you know, of course you all know about HIPAA. Through the schools, there's also something called FERPA, which is what covers, it's essentially their HIPAA of the schools talking to the providers. And so they agreed that, yes, this wording should be able to cover both HIPAA and FERPA. The way we do it in our clinic is we have the parents sign this. We sign it, and we have the parents sign it in our clinic, and we keep a copy on file in our clinic. And then, of course, we either give it to them or send it to the school directly. And so some schools may not completely say it satisfies. Everybody at your organization will have also signed their HIPAA waiver when they come to clinic. But for the majority of times, it should absolutely work to be able to cover HIPAA. And it's really an appropriate way to be able to talk back and forth. So part of it will depend on all of your organizations, and if you have worries, I would recommend you bringing this form to your organization to look at. What we did is we actually built this second form into our asthma management plan. We are on Epic as our electronic health record, and so we built an action plan specifically and then included this, and you can click a button and this piece of paper will print out with your action plan. And this form was agreed with by our administration as well, that it would work just fine for us to be able to talk to the schools. For the read-only portion, her next question there is about whether a signature on the action plan would be enough to allow read-only access to the PCP's electronic health record in a community tab. So the answer to that actually is that for the read-only access to the EHR, that's a completely separate piece. Sujani in Madison is actually working specifically on that thing, is trying to get the school nurses there in Madison access to the EHR to be able to look at it. The hard part and why that piece is a little bit difficult is that in many of the communities, especially like here in Milwaukee, a lot of the little downtown providers, the ones who are seeing the majority of these patients, they are not on a major electronic health record like Epic. They're on whatever one they could afford or they've built or they've gotten used to. So So that can be effective in some places where there's only one EHR is getting them read-only access, but that won't necessarily work everywhere. For our nurses in the Milwaukee Public Schools, as I mentioned, the ones that are funded through Children's do have access through Epic, both to look at our asthma plans and our asthma notes, but also to send us messages directly and write their own notes. So we can see their notes as well. I think eventually as the electronic records start to talk to each other more and as schools start to change more towards an electronic version at some point, I do think that will be much easier to do. But right now, only in specific places is that unfortunately the most effective way to do it. But we do hope it will be more common. The next question about portals, and there is some portals, specifically some actually in Minnesota. There are some portals available for uploading the asthma management plans, and we do talk about this in one of the supplements to the SAMPRO document as well. One of the only things that's difficult with portals is making sure that the schools know and agree with the specific portals that are available. But yes, portals are also an option to get around the parent portion, is to upload it to either a portal or send it directly to the schools. So all those different options are available for transmitting. I don't think we really know what the best way to do it is yet, to be quite honest, and there's certainly not a lot of data of what the best way to get a school form to it is. So I think any different way that you can try to canvass the schools with these forms is a great way to do it. The next question was if there's any data at which metric, either income, average household price, et cetera, schools have a higher level of unmanaged asthma or exacerbations. That's a good question. What we've mostly found is that it correlates with the other elements of what populations are at higher risk. So the kids who are in lower socioeconomic status, the kids who have more exacerbations, more hospitalizations, and specifically the African American populations. Those are the populations that are higher risk, and that correlates to the schools as well. So it's really the same essential elements that we know for asthma control in general that also reflect out of the schools. Good question. Any other questions, thoughts?
All right.
Great, and really if you walk away with nothing else from this, I want you to know that really try to get the school team to be part of the healthcare team as much as possible, because that's often a missed piece. They really are an important part of their asthma care. And make sure that everybody really is looking at these school forms as what they are, which is important orders. One of the reasons we're focusing on this here in Milwaukee first is not only because our numbers are so bad, but because, as I mentioned, this is essentially the only way that providers and nurses talk to each other. So we can't get even just the basic necessities. Certainly it's going to be a long way to getting asthma control better.
All right. If there are no other questions, we will let you go. And I want to thank Dr. Antos for presenting on this. This was really great information. Thank you.
Thank you. I appreciate that. And I'd be happy if anybody thinks of anything else or wants to send me an email or send us any information, I'd be happy to field any questions at another time. Thank you.
Thank you, everyone. Have a good afternoon.